Okay, all right. Okay, for those of you that don't know me, my name is Jason Sword. I work over the Community Living Center as the Minimum Data Systems MDS Coordinator. But today I'm representing the McHenry University as a baccalaureate student. And one objective that we have, excuse me, is a presentation regarding something that would help improve our work environment. What better way to discuss a topic, but something that is pertinent to all of us, teamwork and collaboration. Now I know with a lot of presentations they can get boring and monotonous, so I'm going to try to engage you as best as possible without wearing you down too fast. But basically, I started off on the internet surfing. I saw this sign that had a picture of Leadership Boulevard, my tongue's getting tired, and Teamwork Way. And what was unique about this, if you notice, is that teamwork and leadership are entwined. When you have efficient leadership, you have efficient teamwork. Because without proper guidance, the team doesn't know the proper goals, the objectives that they are supposed to do, what is their plan of action. However, you can have effective leadership but not have good teamwork. Now, any questions how that could be? For example, how many of you have gave patient education, you tried to direct the patient the right way, but the patient wasn't listening? The patient, he might have been there or she might have been there, but they really weren't there. So basically, you can have the proper leadership guide, but the team needs to be in the same, so to speak, congruence with the leader in order for effective patient-centered care to occur. Now, this is very pertinent for us because looking the Quality and Safety Education for Nurses, QuinSED, the American Organization for Nurse Executives, and the Institute of Medicine, IOM, they all recommended for nurses to understand teamwork and collaboration. In fact, the AONE, American Organization of Nurse Executives, made it a requirement for nurse manager competencies for nursing leaders to be able to provide relationship management and influence behaviors. Natasha. However, for all nurses, QuinSED, the Quality and Safety Education Nurses, they developed a project to identify teamwork and collaboration as a required competency in order to attain improvement for a better healthcare system in relation to patient safety. We all know patient safety is a priority. I'm sure when Joint Commission would drop by, that was one of their top priorities. In fact, I'm sure everybody's heard of cell data. Well, cell data is something that the entire VA system looks at in ranging how each facility is. Well, for example, over the CLC with cell data, one of the main components is about falls. When you look at falls, you also look at patient safety. So it kind of correlates one with another. So how do you improve on the data? One way is to have efficient teamwork. Okay? Looking at the right part of this poster, I looked at the saying that President John F. Kennedy stated: "As we express our gratitude, we must never forget that the highest appreciation is not to utter words, but to live by them." How many of you have heard the saying, "Don't do as I do, do as I say"? Okay, now I'm going to get real personal. How many of you have had nursing leaders who started off, whether it be a charge nurse, director of nurses, a manager? You knew that they didn't live up to the potential that they demanded from their staff. Okay, let's take it a step further. How many of you have had co-workers do the same thing? And I'm sure all of us have heard that saying, one bad apple ruins the whole bunch. What's the main thing about the VA right now? They like to look at us and say, well, maybe we're not an effective healthcare system. And it may not necessarily be Marion, Illinois. It could have been like several years ago in Phoenix. But it affected the entire VA. Well, it's like us. If we have one bad apple, that one bad apple can affect us as a whole unit. So, how do we improve on that? Well, for one, we need to know what to look for. All of us are CPR certified. We've had our training. When you were trained for CPR, what's the initial step that you're supposed to do? If you see a patient, let's say on the ground, and you walk in on that scene, what's the very first thing you're supposed to do?
Call 911.
Before that?
Check the patient.
Before that?
Check the safety, the
Check
surrounding,
the environment.
the environment.
Now, why do we need to check the environment? We need to check to see, is the environment harmful? I mean, if it's not safe, we don't need to be implementing care. Well, likewise, you and I, we need to look around and see, is our work environment really what it's supposed to be? Is it safe for the patient? Now, you might say, well, Jason, it's obviously got to be safe, but if you've got deficient teamwork and collaboration going on, it's really not that safe. It may look safe. You might say, well, what do you mean? Well, how many of you have either taken care of or know somebody that's been diagnosed with cancer? Okay? Usually when they get the blow to them from the doctor saying, you know, you're diagnosed and it's terminal, they, majority of the time, not all the time, will say, gee, I never felt anything, maybe just a small nagging pain. And then the blow hits them, you've had something bad the whole time. Well, likewise with us, we might have just a few things. Oh, this person, she or he likes to argue a little bit. This person likes to take off early all the time. This person calls in, you know. But it's okay, we're functioning fine. But when you start adding one and one, it can lead up to something that could lead to a detrimental or adverse event. Now, let's look at this. Like I said, I'm sorry, some of you guys might not be able to see this, but I'll take this out. I'll pick on you guys for right now. Okay, why is it important? Okay, we got a picture here of a doctor, 2 nurses, and a patient. When you see that, you think about you're giving efficient patient care, and you're wanting to do the best job you can. But when looking at that, you can see 2 things. You can see a healthcare team and an interdisciplinary team. Now, a healthcare team, we usually revolve that around direct care staff, like CNAs, RNs, LPNs, and also the providers, nurse practitioners, PAs, medical physicians. An interdisciplinary team, however, revolves not only with the direct care, but it revolves around indirect care, like social work, occupational physical therapy, recreational departments, your chaplain services. And one main responsibility I have as an MDS coordinator is we have weekly care plan meetings. We have the interdisciplinary team together. And our common goal is the overall effective care of the patient. But in order for that to happen, we all have to work together. For example, discharge planning. I know discharge planning is supposed to begin on day 1, but, Tammy, unless therapy would agree with social work, who would agree with the provider, who would agree with me, we're not going to get a right date down. So we have to work together. And name me one thing that we've got to do in order to make sure that we know what's going on and how to give that proper discharge date. We got to talk to one another. We got to communicate with one another. Now, we all know what teamwork is. It's mainly members of a group that's working together for a common goal. But now collaborate takes it a step further. It's working in a joint effort with others and cooperating with an agency with which one is not immediately connected. Okay, in other words, it's just like all of us are nurses, but we collaborate with other disciplines that we may not be necessarily closely connected with, affiliated with, but we do that like lab. You know, if you got a patient's got to go to the lab. Or like if something detrimental happens and you call the social worker in, you may not be affiliated with the social worker through the same discipline, but you kind of communicate with them, this is what's going on. Okay, let's take another example, a rapid response. What happens with the rapid response? You have something real bad happens. You call that number, they come. It's not just necessarily one person, but it's several people together, and they have to communicate with one another. I was telling Deanne, I said, I'll never forget this. We had an incident several years back. The patient had a trach and there was an obstruction that started occurring. They called a rapid response on him. And I remember they were there, the doctor, and he was very professional, but I can remember he was diaphoretic, sweat just pouring out. One nurse was actually dabbing his head with a towel. But what I noticed is that the environment was calm, even though his oxygen saturation was going down to the 50s. They all were working together as one. Now, here's the sad part. After that occurred, I walked over to the then nurse manager, and I said, it is a sad thing to see more congruence and a better work environment with an emergency than it is with a regular morning huddle report. Now, that is something we've got to look at. We are a team. We work together. A lot of times we're called our second family. Some of us don't even want to consider ourselves as family. But, I mean, hey, we're here and we're working together as one. Whether you know it or not, you kind of understand each other's personalities. You understand your likes, your dislikes. There's a lot of people that I work with, believe me, when I see them coming, I want to get it going because I know how they are. Okay, how many moms do we have in here? Okay. All right, you see here, I'll tell you what I'm going to do. I'm going to kind of swerve this around if I can, that way, if possible. We've got this one gal, she's kind of down in the dumps, depressed, and we've got two teenage gals whispering to one another. And you see that this one is kind of depressed, down. One thing they always talk to us about a workplace is workplace bullying. But if you noticed, they weren't yelling at that gal. What were they doing? They were talking behind her back. You know, I could be down the hallway, you could be talking about me, and I could walk up and you could just stop and might not even have to say anything, and I already know that you've been talking about me. So, what's going to come to mind? I'm going to have that in the back of my mind. And let's say I need your assistance to help me on patient care. You think I'm going to be that eager asking for your help? That does happen ever so often. So we got to realize, like with our work environment, is that it's not necessarily just up in your face, but it can be behind your back. You know, the golden rule says doing to others as they would have you doing to them. You know, you wouldn't want anybody talking behind your back, and I certainly wouldn't want anybody to do that. Another thing of it is that when I'm talking to a patient or a coworker, or if you're talking to me or another team worker or a patient, you're wanting them to actually hear what you've got to say. And that's called active listening. You know, haven't you ever had a dilemma where you were just down and out and you really need somebody to talk to? And you talked to somebody and you knew they really weren't listening to you. Their mind was way on something else. They might have been thinking about shopping or something, or they might have been thinking about a ball score that they saw. And you feel like, I've wasted my time. And this is something that affects our work environment. I mean, not only do we have to be active and engage in our care, but we've got to be active and engaging in things that are not necessarily verbal, but nonverbal cues. Okay, now, looking at some things, I had told your nurse managers that I would be bringing up some things, and one main thing, since I brought up morning huddle, poor reporting. Now, can anybody tell me what's another word for reporting? Communication. Poor communication. Now, that can be from either co-worker, like nurse to nurse, but it could also be provider to nurse. It could be to the place that, you know, you've got a situation that's going on, and the provider wants you to do this and do that, but you two haven't really communicated one with another about what's really happening, the whole scope. Now, here's another aspect of that. You may not have the opportunity to say everything you want to say. For example, I have been in meetings in my nursing career, and I've had individuals that you would be explaining to them something that's really going on, and they would shut you down real fast. Well, that's not so. We don't do it this way. And you do one of two things. Either you shut down and don't say anymore because you feel like you're wasting your breath, or you feel like, no, I'm going to tell you what I think. And so what happens? We call that a hostile work environment. You might be tensed about that. Here you are, you know you're needing to communicate. You know, on facilities that are 24/7, a lot of times their shift reports, they really gear up each shift to give an efficient and effective report, and that way every detail is touched. But what's bad is I have seen charge nurses, and they'd be in front of the provider, they'd be in front of the nurse manager, and they say, I didn't know this, because it wasn't addressed to them in their shift report. And they may necessarily have the opportunity to check the chart, because something might be going on. For example, one time I came to work, and guess what? We were welcomed like a good morning cup of Folgers with a cold that occurred. And you didn't have time to really research anybody's charts. So that's why effective communication is so pertinent to patient-centered care, but that is also a sign that you don't have an effective work environment. Now, I do want to state this before I continue on. One thing that I would like all of us to understand is to be able to identify at least 3 things that affects our work environment. Another goal that I think would be pertinent is that we would be able to identify 3 factors, 3 ways to improve teamwork and collaboration. And along with that, the third goal would correlate to teamwork and collaboration. How do we improve on our communication skills? Well, for one, we already know active listening is one. 2 is that we're available if need be. It may not be where you can just sit down and talk. I've, since taking this role as MDS coordinator, I've had many times where a staff nurse would want to talk with me, and I may not necessarily have the time to talk with them for 15 minutes, but I do take time to just listen to them. If I have to get done with something, I try to use courtesy, politeness as much as possible. And those are at least some ways that we can improve our communication skills. There's always ways that we can improve on ourselves. Something that also that you notice with a poor work environment is loss of representation. You just don't feel like that you're represented. You take like some of those meetings I was talking to you guys about, sometimes the discipline doesn't even show up. Why? Because they don't feel like it's either important, or they feel like there's no use, nobody's listening to me. It'd be like having a staff nurses meeting and you feel like there's no need me saying anything. I'll never forget, my dad used to work at a sales department, and the supervisor, he would always have these meetings, and he'd ask them, well, what do you guys think? And somebody'd say this, somebody'd say that, and he said, well, this is the way we're going to do it. He'd already made up his mind he was going to do it this way. And they finally got to the place they didn't say anything anymore. That wasn't a good, effective teamwork environment. And that's the way sometimes we get. We can get like that. Finally, one major thing we got to realize is that ineffective communication has been cited by a joint commission as a primary cause for adverse events. Now, I already stated about like the doctor and the nurse. We could have situations where something real simple can become something detrimental. You take like mental health. You might have a situation where, you know, this veteran has certain triggers, and you've got to really be careful about that. And because you may not have necessarily communicated with your staff, your co-workers, they might accidentally walk in on this gentleman or lady and do something that would trigger an adverse event in their lives. And an adverse event does not necessarily have to be medications. It can be medications. I know over the CLC they are really big about making sure that we connect the dots, cross our T's, do everything. And the main reason is that all it takes is one event and we're sunk. Actually, I will put it like this. One event doesn't just sink the CLC, it sinks whoever's involved. It sinks those that were doing the event and those that knew about the event but didn't do anything. Okay, I've got 3 stars here, a gold, a blue, and a red. Are you a gold, a blue, or a red star? I'm sure all of you remember the commercial where the gentleman would say, no gold star. Well, anyway, the reason why I have this here is that our nursing population, we're not all the same age group. And we're not always in the same, have the same background, the same geographical location that we reside in. Some people I've worked with lived in northern Illinois, others lived in Arkansas, others lived in Missouri. I've had people that were in their mid-60s, people as early as 20. Now, why would I say all that? Because teamwork and collaboration revolves around culture. And what's the big thing about culture? It's your perceptions, your values, your beliefs. But a big thing that has hit us lately is we have like a melting pot of different generations. And I was looking at this, and it was stated, Moore, Everly, and Byers stated, a workforce that encompasses several generations must learn to work together in order to provide effective patient-centered care. Now, why would you say that it's important for us to know about different generations? Any takers? Okay. We have baby boomers, Generation X, and millennials that are involved in the workplace now. Now, I know how they describe the groups. You may be a millennial, but you may not be like a millennial. You may be a Generation X and not have the characteristics of a Generation X. You could be a baby boomer and be just like a baby and whine all the time when you're at work. Believe me, I work with one. But here's what I want us to focus in on. Generation X accounts for at least 50% of the workforce now, whereas millennials comprise 26% of the nursing workforce. That means the young kids we're dealing with right now, they're going to end up becoming the majority. I'll never forget, I realized how old I was getting. I'd always been, to me, young. But we started hiring a heavy influx of people that were 20, 21, 22. And we had this patient we were taking care of. And I nicknamed him Country Bumpkin out of the country song in the 70s. And I was just talking to this guy, and I said something. And he looked at me with this blank stare. And I said, you know, the song in the 70s. He looked at me and said, Jason, I was born in 1989. I thought, that really didn't make me feel too good. But anyway, it shows that everybody's different. Now, looking at this, here's the key ingredients. Generation X nurses do not feel obligated to work in teams. As a general rule, they are self-directing, which could result in a rupture in teamwork, which could lead to detrimental care. Millennials, on the other hand, they consider a high priority being a balance between work and life. So they really demand flexible work schedules. Now, I hate to be the bearer of bad news, but a lot of times you can't have flexible work schedules as a nurse. I remember some of the jobs I worked with, taking a day off was like having an act of Congress. But what happens is when you have different perceptions, different values, we take them to the work, and so what goes for one may not go for another. So one way to improve teamwork and collaboration is kind of knowing, what does this person, kind of think? Does this bother them? Does that bother them? It's kind of like you're a big brother or a big sister, and you're watching out for them. Now, I know some of you might say, but there are big brothers and big sisters that like to fight with one another. That's true. But that's where your nurse manager is the big mama, and she'll take care of you.
Can I call her that?
But I will say this, when we had that influx of millennials coming in, and I'm not trying to pick on millennials, but it was just a event that happened. And the reason why I know is I was a charge nurse. I could tell the personality differences. I could tell how this group was, that group was, and this group. Now, am I saying all millennials are bad? No. Am I saying all baby boomers are good? No. I'm saying each one is an individual nurse. But we need to know from one another. Okay. Now, here's the big thing. What can I do? What can you do to improve the work environment? You know your resources. You research, you understand what your resources are. So, looking at that, your resources are something that's evidence-based. So, what we're looking at, something that we can incorporate in any nursing field. Now, I know we work at the VA, and the VA has certain protocols we got to do. One thing I want to add is ethnography, which is the systematic study of human culture, is a good evidence-based resource that we can use. Now, that doesn't mean you're a scientist or anything. What that means is that you understand culture is influenced by authority. You understand that every nursing facility has a hierarchy. So you know that their perceptions, their values, they're affected also by the hierarchy. And when they did this research, they were checking on issues surrounding the interdisciplinary team. And this was mainly in the surgical unit that they were checking on factors that hindered teamwork and collaboration. And the main thing is how culture was affected by a hierarchy. Now, how many of you have worked with a nurse manager, director of nurses, charge nurse, and they were very authoritarian? Meaning, what they said goes. Their words were just like the words written on Mount Sinai stone. That's the way they were. Then have you had a nurse manager that was more like easygoing, laid back, type B person, anything goes? You felt like they came out of the 60th generation because they were like, hey man, like a hippie or whatever. And then you have the other one, which is a facilitator. A facilitator is someone that can balance things. Might be a little authoritarian at times, on things that you need to know, but very flexible. And each work environment, when you have a different nurse leader, you will see how that affects the whole team. I'll never forget, when I hired in at the VA, I had to do an orientation on third shift. A veteran nurse was talking to me. This was day 2. I had 3 nights I had to work on the third shift. She said, Jason, you're going to notice a big difference with the team, because I'm not going to be here and this individual is going to be the charge nurse. I found out very fast it was different. And why? Because this particular staff nurse had check marks on everything, and you went by this and that, you went by this and that. And you could tell, even though I know she was trying her best, the authoritarian style just wasn't cutting it. There wasn't a good flow of communication. In fact, many of them didn't want to talk with her. So we've got to realize that, yes, we abide by an authoritarian system, but we've got to also realize that in order for good, effective teamwork to occur, you've got to have good leadership. And by the way, I want to add, who makes a leader? Is it just a charge nurse? How many of you have worked in the private sector and you saw that the LPN was the charge nurse? How many of you have seen CNAs that were veteran CNAs that knew what was going on, and they stood up and they acted like a leader? All of us can be leaders. So it's not just your nurse managers that we're looking at, effective leadership, effective teamwork, but everyone. Okay, another good strategy that we can use, and this is not only a resource, but this is an available resource for the VA. Team steps. This is team strategies and tools to enhance performance and patient safety. Like I said, they're really sticklers about patient safety. Basically, in a nutshell, this is a research plan that uses simulation. Now, how many of you have cell phones? And how many of you like to shop on your cell phone? Well, you could use Team Steps. Team Steps just uses kind of like a simulation protocol. It was developed so that it would enhance teamwork and collaboration in a way that you had a situation that was going on and you can kind of see what's happening. Well, here at the VA, we're doing online CPR, and it's pretty well the same thing. Now, the question would be asked, well, how in the world can we implement Team